Well, thank you, Carol, for the introduction. I'm glad to have the opportunity to speak with you all. And Jane, if you don't mind, you can share the screen. Of course, this will be recorded, but I've also shared the slide deck. So everything that is addressed today, you guys will have a copy. Um, so yeah, I'll go ahead and get started. So Carol already did the introduction, but again, my name is Kirsten Minor. I'm the Health Program Manager for CleanAire NC. And many people don't know that the AIRE, A-I-R-E, that's actually an acronym, which stands for Action and Innovation to Restore the Environment. Next slide. And next slide. That's me again. So CleanAire NC, prior to we rebranded, we were known as CleanAire Carolina. And back in 2021, we actually rebranded as CleanAire NC. But nonetheless, our mission as an organization is we are advocating for the health of all North Carolinians by pursuing equitable and collaborative solutions that address climate change and air pollution. And our vision is where there's a stable climate and clean air, it creates a healthier lives for all. And in that picture in the bottom left corner, maybe you're right, depending on how you're viewing your screen, that's just a picture of our team at our most recent, it was actually last month, our NC Brief conference. So we're a very small organization. We're statewide here in North Carolina, but we're a small but mighty team. Next slide. So in addition to our mission, our value, our goals is that our priorities is public health, as Jane mentioned, or Carol mentioned rather in the introduction, my background is public health. Environmental health is inclusive of air, that is our space, but oftentimes air, environmental health, it's water quality, it's soil quality, it's a number of different environmental health outcomes. And then environmental justice. And then our values is respect, passion, and collaboration, because the work that we do, we can't do the work without collaboration with community members and groups such as yourself. Next slide. So we are just a little over 20 years old. CleanAire NC, at the time, it was CleanAire Carolina, was actually founded a little over 20 years ago in Charlotte. So our roots and most of our work has been in Mecklenburg County. Originally, it was just a group of 4 volunteers from the actual Sierra Club. And originally, the coalition got together focusing on air quality in Mecklenburg, specifically relating to school buses. So these organizers and our former executive director, June Blotnick, along with a couple of other volunteers, around 2007, they actually launched their first campaign focusing on children's health and specifically focusing on air emissions associated with school bus emissions. Because back in 2002, at one point in time, Charlotte actually had some of the worst air quality as it relates to ozone emissions. And a lot of those emissions come from, or most of emissions actually, when it comes to greenhouse gas emissions, still come from our transportation sector. So that is individual cars, that's medium heavy duty trucks, buses, etc. 5 years later, we did launch a statewide health program. We got into the health space because, of course, air emissions do impact our health and impacts all of our health because we all have to breathe in air. But health professionals specifically are trusted messengers. So whether doctors, nurses, we wanted them to be included in our advocacy efforts, because typically when a doctor is speaking in this picture that you see, it's actually, his name is Bob Parr. He's a retired physician. He's in Wilmington area, but he's actually speaking to the North Carolina General Assembly, advocating for the health of North Carolinians as it relates to health impacts associated with air pollution. And then in 2017, 5 years after that, we use these air monitors that are known as PurpleAire. PurpleAire is still a low cost, even though it's gone up a little bit in cost in recent years due to, I feel like everything's gone up in cost in recent years, inflation or whatnot, but they're low cost sensors that can be portable, or they can be attached to one's home, church, or an area where you may be concerned if there's elevated levels of air pollution. Again, I'm saying particulate matter. But that began in 2017. And the picture you see there is actually one of our air keepers. That's what we name individuals who host PurpleAires, provided by CleanAire NC. And that's Ron Ross, that's his name. He lives in Charlotte in the neighborhood of the historic West End. And then I already mentioned earlier on the call, in 2021, we rebranded from CleanAire Carolina to CleanAire NC, but we've been in the clean air advocacy space for 20 years, a little over 20 years at this point. Next slide. And this is just a brief video. So Carol, I believe if you click on it, it may be able to show, or it may pull up the YouTube clip.
We all need clean air to breathe and a healthy climate to live in. We don't always think about the impact of invisible air pollution, but breathing dirty air takes a toll on our health, contributing to asthma, heart disease, and lung cancer. Air pollution caused by energy consumption and transportation also drives climate change, which in turn amplifies the impacts of poor air quality and threatens our health through extreme heat waves, more intense storms, and the spread of insect-borne disease. Black, brown, indigenous, and under-resourced communities are especially vulnerable to these consequences. Fortunately, we have the power to end this cycle. Solutions to dirty air and the climate crisis exist and can have immediate health benefits for North Carolina communities. At CleanAire NC, we're protecting what connects us with on-the-ground solutions. We're equipping people with the knowledge and tools they need to chart a better future. We're engaging citizen scientists to measure how air pollution impacts different North Carolina communities. We're fighting for stronger protections on our air and holding polluters accountable, no matter their size or clout. We're mobilizing health professionals to use their trusted voices to advocate for policies that improve public health. And we're partnering with impacted communities to fight environmental racism and improve climate resiliency. You can make a difference too. Your voice and your actions have the power to turn our shared goals into real progress. Together, we can build a cleaner, healthier North Carolina. So how can you help? Join our network to push for stronger climate and clean air protections. Host an air monitor to measure local pollution patterns. Become a climate ambassador and take the lead on climate action in your community. And support our work to restore North Carolina's environment. When we all do our part, it adds up to make a big difference. Let's work together to build healthier lives for all. CleanAire NC. Healthy climate, healthy air, healthy people.
Thank you. So that video clip is just a broad overview, but again, I'll go more in depth. So we do have a total of 5 programs. We have our environmental justice program, our CleanAire NC health program, our community science program, formerly known as citizen science, our education program, and then our advocacy program. And I will break down each of those programs in the next slide. So our advocacy program is our policy focused program. We know that in order to make long-term changes, policy is key. So that requires individuals such as yourself taking action for policy solutions that hold polluters accountable. Again, as you heard in the video, no matter their size or clout. There are 3 initiatives that we focus on. So one is clean energy, clean renewable energy specifically. So shifting from fossil fuel sources to renewable energy sources. As I mentioned earlier, Transportation is actually a #1 source of greenhouse gas emissions in the state. So recently, Governor Cooper released a North Carolina Clean Transportation Plan. So we're looking at Executive Order 271, which is focusing on electrifying medium heavy duty trucks, because as I mentioned earlier, medium heavy duty trucks in the form of like school buses, for an example, they do release a significant amount of greenhouse gas emissions, NOx, nitrous oxide, and all of that is a precursor to ozone pollution. And it also releases diesel emissions. So clean transportation, and then last but not least, this is a long-term focus, is that we would like to see our work lead to more equitable air quality permitting. So in North Carolina, only 3 counties, Buncombe, Mecklenburg, and Forsyth, have their own county level division of air quality. The remaining 97 counties in North Carolina, when it comes to permitting decision, that is through North Carolina Department of Environmental Equality, or DEQ. And when it comes to the permit process, whether it's a new or existing company, we do know that certain communities already have what we call cumulative sources of pollution. So they have multiple agencies or companies that are contribute to pollution, whether it's in the airspace, the water quality space. Is that what we like to see in the future is, when it comes to issuing permits, that decision makers are able to look at, okay, well, if this is already an overburdened community that already has a higher sources of exposure to pollution, do we need to continue to give permits to those organizations? What are we going to do to make sure that we protect the health of all individuals, but especially the communities that are most impacted by cumulative sources of air pollution? So this picture you see here is actually from this past fall for the NC Carbon Plan, which is, of course, Duke Energy and the North Carolina Utilities Commission coming up with a plan that will impact all North Carolinians, but looking at our energy sector. What are ways that we're going to be able to hold, the energy sector accountable to reduce their greenhouse gas emissions? So that was individuals actually advocating in Charlotte. Next slide. Our community science program, again, formerly known as our citizen science program, that's actually us working with communities to measure local air quality from, got a little bit ahead. So we're through our community science program, whenever you're able to go back, is we're actually deploying those purple air monitors, which I mentioned earlier. These are low cost air sensor technology. So these are community led. It can be just individuals. It doesn't matter what county you're in North Carolina. If you're concerned about air pollution and you're interested in hosting an air monitor, we will actually come to you and we can help either install the air monitor or we can deploy it. And we actually have on our YouTube channel an instructional video, how do you install these air monitors? But the main thing, it's community driven. And you're like, okay, when you install these purple airs, how are we able to collect information, or what is the information we're collecting? We're collecting particulate matter exposure data. And this is actually a website. If you go to purpleairmap.org, I believe, or is it purpleairmap.com, you can actually see a live map showing what the air quality index is throughout the North Carolina communities if they have these purple air sensors installed. So when I say air quality, that's actually, if you think about a color code, it's from green being green air quality, or when it's in the green, it's good air quality for everyone. Once it begins to get in yellow, if you're a person with an underlying health condition like asthma, COPD, you may want to start taking precautions. And then anything in orange, red, or above, it's really a threat to anyone, whether you're healthy or a person with underlying health condition. There's different times, especially now that we're actually about to be what EPA, what we recognize as an ozone season. So when it gets warmer outside, the hottest time of the year, and of course, in many, schools are about to let out, people are going to be traveling and vacationing, barbecues, 4th of July. There's different times where we'll see actually spikes in those purple air sensors. So that map, which I did see was put in the chat, so thank you for who put that map in the chat. You can actually, it's a lifetime map. And I'm pretty sure if you was to check that map on the 4th of July when people are barbecuing and let off fireworks, you'll see actually spikes in the air quality. And again, when those spikes go up, if it's in the yellow, red, or anything darker than really red, then it could be a threat to the health of individuals. And yeah, that's a picture of our community science manager, Deja, actually installing a purple air monitor at Airkeeper's house. Next slide, please. So health, I mentioned earlier, and you guys saw in the slide at the very beginning, one of our health leaders, Dr. Bob Parr, who was speaking actually to the North Carolina General Assembly on behalf of North Carolinians, but specifically as it relates to health, is that we want to leverage these trusted voices to advocate for a healthier, more resilient future for all. So this picture was actually taken at the North Carolina Public Health Association conference back in September in Wilmington. But our signature initiative within the health program is our NC Brief conference, which I'll speak about a little bit later on, a couple of slides afterwards. But again, this is a statewide network of health professionals, and we provide air quality education as well as climate education, because historically within medical school curriculum, it's changed a little bit, but for a number of years, air pollution and climate issues weren't really addressed. So it wasn't uncommon when actual practitioners, again, nurses and doctors, they're taking care of patients, whether they're taking care of them in a hospital setting or outpatient setting. If they're sending individuals back to communities or neighborhoods where the environment, quality is not good, especially I'm going to speak to air quality. They may see these patients coming in and out of the hospital or the healthcare system time and time again. And initially, your first thinking may be, well, what is their diet? What are their exercises? Do they smoke? Do they not smoke? Oftentimes people may not think, well, do they live in an environment where there's poor air quality? Because if I live in a neighborhood where, there's heavy traffic pollution coming from buses and trucks, or there's interstate and major highway systems coming into my community, or maybe I live close to, in a rural setting, a concentrated animal feeding operation or a CAFO, and there's the burning of animal waste or burning of coal, being emitted into the air, has nothing necessarily to do with, am I, being compliant with taking my medicines, or, whether I smoke or not smoke. The air quality in my region may not be good. And if I have asthma and I'm constantly being exposed to it, it can trigger, an asthma attack and lead to hospitalizations. So by us providing that air quality education to all health professionals, they're better able to serve their populations, but also, again, they can support us in our advocacy efforts. Next slide. So education is key. So we want to have an intergenerational impact. So whether you are, very early in your journey, or you're, more seasoned, a veteran in your journey as it relates to learning more about how can climate change impact the health of current and future generations, we want to equip all North Carolinians with the knowledge and tools they need to advance these climate solutions. So we do have our NC Climate Ambassador training. You see in the picture, our Charlotte Mecklenburg climate leaders. We have our community science in schools, and this is something that we're expanding more into. We used to have a program called CleanAire for Kids, where we were actually working with elementary, middle school, high school groups, and just educating around, by doing like kind of fun science fairs. And even you see in this picture, a young student or a young person, looks like they even have like the Girl Scout kind of badges on the back of their jacket, but engaging young people into what are ways that we can be more sustainable, And then recently we did launch a monthly book club discussion, and those books are actually decided upon community members or climate ambassadors. And typically those discussions or the book that is selected for that particular month is around issues relating to environmental health, climate justice. So yeah, next slide. And then our environmental justice program is again going to targeting the root causes of disparate environmental burdens and charting a path to restoration. So in this picture, you see our community science manager, Deja Wall. Ron Ross, you saw him at the very beginning, 2017. He's one of our first air keepers, as well as Maddie Marshall, who's another community member. They're both leaders within the Historic West End. We partner, CleanAire NC, we've been partnering with the Historic West End Green District going back to 2017. So in this picture, it's actually a ribbon cutting ceremony. Because within the Historic West End, in regards of what's all this advocating that we're doing, back in 2017, Ron Ross, along with Maddie Marshall and another community member, we gave them 3 purple air sensors that they deployed within their local community. And over the course of a number of years, they were actually able to put together a report with our support from our community science manager at the time to actually put together a presentation to share with the Mecklenburg County Commission. And during that presentation, Ron Ross, whether it was the Stars or Alliance, he actually asked the Mecklenburg County Commission if there could be a federal air monitor established into the Historic West End community, because there wasn't a federal air monitor there at the time. And it just so happened the EPA did have a federal air monitor available, and they actually did get a federal air monitor installed in the Historic West End neighborhood. And there's been a couple of electrical vehicle charging stations launched within the Historic West End. So these are all just kind of highlights of when we're advocating and working with these community groups, actually seeing solutions being connected to these communities. We did do a healthy air education series, which was partnering with the Mecklenburg County Health Department, as well as asking a couple of our health members to speak to community members, giving a more clinical perspective. So it was 2 sessions. This is back in August and September of 2022. But the first session was focusing on the connection between air pollution and chronic illnesses, including COVID-19. And we had the director of Mecklenburg County Health Department, Dr. Raynard Washington, speak there. And then the second session, we also had a focus on the connection between air pollution and just the health impacts associated throughout the life course, beginning with preconception, but maternal and child health and throughout the end of life. And we had a pediatrician speak. So both, whether it's a pediatrician, endocrinologist, a nurse, a primary care physician, we actually had healthcare professionals who work in both hospital settings as well as outpatient settings, or some actually, one of Dr. Tracy Ball, she actually has a medical clinic where she can actually do house calls. I know that used to be back in the day, house calls were a thing, but it's come back. So they gave their perspective of what are ways that individuals can, of course, protect themselves from air pollution. But also it's important for community members to get connected with these healthcare professionals, because now that, we're all in the same page and their goal is to improve the health of all individuals, but especially individuals who have these existing health conditions, it's not a one-way communication. They're working in tandem with each other. So when the last bullet point, it's saying neighborhood air monitor clusters. When we say clusters in the case of the deployment of purple airs, that's typically 10 to 15 monitors. And the reason why we want to do clusters is because air quality can vary significantly, even in a small neighborhood or community. And again, that depends on where, in an area you are. If you're closer to, I'll say, Interstate 40, I-80, 40, 85, other highway systems or other industrial sources, you're going to have more spikes in your purple air monitor than an individual who may live in an area where there's more green infrastructure. So trees acts as a barrier of catching greenhouse gas emissions and carbon dioxide that actually helps clean the air. So they may actually have a reading for better air quality. So it's important for us to deploy multiple monitors in a neighborhood so we can truly get a good reflection of what is the air quality and where disparities may exist. Next slide. So the initiatives, I kind of already spoke to it. So the Historic West End Green District, I spoke about trees, and this is a perfect example. This is actually us working with it's Charlotte's trees, or Trees for Charlotte, just installing, or actually planting trees in the Historic West End, because trees and other plants can actually help reduce air pollutants. I think we advanced 2 slides, and if we go back to the prior slide. And then actually the Charlotte Mecklenburg Climate Leaders, again, part of our education program and Climate Ambassadors program, you actually see our former Executive Director, June Blotnick, speaking. This is at the Mecklenburg County Commission hearing, I believe. And of course, we have supporters. This could be, these are climate ambassadors, advocating for cleaner air. So vote Charlotte Green. You see some of the signage, but that's what we're doing. And again, we can't do this alone. If you further zoom in, you may actually see it's former Mayor Jennifer Roberts also in the background. So for individuals who are engaged, I know that this is the Piedmont region, but you may actually see some individuals that you have crossed paths with. Next slides. So I mentioned one of the signature deliverables for our organization, but specifically the health program, is NC Breathe. We actually just had NC Breathe last month. It was in Charlotte, April 6th, where it's actually our signature event where we bring together diverse stakeholders to come together for one day to speak about what are not only, raise awareness and educate people around issues that impact North Carolina communities, but come up with solutions. So these are powerful keynote speakers and panel discussions, as well as leading, or building partnerships with leading voices. And then we will actually be putting together a post-conference report, which will be shared with policy and decision makers. What are recommendations that can actually advance a climate justice agenda? And that's one of our actually board, or she's Atrium Health, Dr. Erica Ellison Stewart. She actually welcomes our keynote speaker. If you go to the next slide. We had Dr. Aaron Levy, who is a hospitalist pediatrician at Levine Children's Hospital, which is a part of Atrium Health System. He spoke and gave the perspective of, he sees by the time that a patient would see a Dr. Aaron Levy, this is a child as well as their family or their caregiver who is experiencing, poor health. And Dr. Aaron Levy, he spoke a lot about specifically around asthma, because asthma is the leading chronic disease in children. And I think it was very important, and he did a great job. This conference was recorded, so if individuals actually want to watch back the recordings, then I can share that information at the end of this presentation, but I would definitely recommend it. And then our other keynote speaker, we had Mustafa Santiago Ali, who's the Executive Vice President for the National Wildlife Federation. He spoke to, of course, environmental justice, but gave us solutions. What are, federal opportunities, state opportunities for individuals to get engaged to advance a climate justice agenda, because we're actually at a very pivotal time in our country. The current administration, the Biden administration, actually has advanced a number of climate not executive orders, but actual legislation. So we have historic federal funding, billions of dollars that are coming down. And of course, those dollars are coming from federal government down to the state government. And now it's our responsibility to make sure that the money that has been set aside for, whether it's advancing the climate justice initiatives or making sure that communities that are most impacted by environmental, injustice, they're actually able to get access to funding to improve the conditions of their local communities. Next slide, please. So over the course of, again, we've been around for just a little over 20 years. We've gotten a number of awards and recognition. So back in 2021, we did receive an American Climate Leadership Awards, 2019 NAACP Community Champion Award, a Mobile Care Award, and 2014 Visionary Champion and Community Sustainability Award. And again, all of this work, one of our, again, key things is working in collaboration. So even though CleanAire NC, we may receive awards, it really is individuals, community members working with us and supporting our work. So it's not just one person. This is a community effort, community-driven effort. Next slide. So here's our current team. Again, in total, if you count us up, it's 10 of us. So even though we're statewide, again, only 10 individuals, and half of our team, actually more than half of our team, is Charlotte based. I'm actually here in local to Durham, so I believe a couple of people on this call, since it's a Piedmont group, hopefully we may be neighbors, so I'm actually here in Durham. But here's actually a picture of all the individuals who are working on our team currently. Next slide. So what are ways that you can get engaged? So we are a nonprofit, meaning that, of course, we're dependent upon private donations as well as, of course, grants. So we always encourage individuals that if you really are passionate about whether it's air pollution, climate change, anything that I just spoke onto this call tonight, you can become a financial supporter. You can, of course, join our advocacy network to push for stronger climate and air protections. You can either host or sponsor an air monitor measure pollution levels across North Carolina. So in regard to sponsoring air monitor, we do provide these purple air monitors to community members that are most impacted. We do prioritize environmental justice communities, but we do purchase these air monitors. So sometimes, air monitors have gone up, but maybe you may not believe that air quality in your local community is good, but you're aware maybe you have a family member or you're aware of a community member where air quality may not be, as good. You could actually sponsor an air monitor being deployed in that respective community. And then last but not least, ways that you can get engaged with us is just take the lead on local climate action by becoming an NC Climate Ambassador. And that program is actually, if you visit our website, there's links if you go to our education page of what you can do, how do you become an NC Climate Ambassador. Next slide. So that's just an overview. So I thank everyone who's on this call. If you ever want to get in contact with me, it's just my first name, Kirsten at CleanAire. Again, remember that E at the end of airenc.org. My phone number is 704-257-0869, or you can just go to info@cleanairenc.org. That's kind of our catch-all. And it can be redirected to whether it's health program manager, or you want to get in communication with other program managers, our marketing communications team, or even our executive director, you're able to do so. So thank you all for your time, and I'm open to comments, questions, or concerns.
You're muted, Carol.
Great presentation. Thank you so much, Kirsten. I'm sure we have questions for you. One of my questions is, and you may have gone over some of this, but how is the data collected on the purple air monitors? Does the person do that, or does it send its own message somewhere else?
Yeah, so it's actually, it's automatic. So those purple air sensors, and again, there's a video that describes it from beginning to once you receive it in the mail, or for Deja, our community science manager, actually comes to you and installs it at your home. But once you install it, it is actually connected to Wi-Fi. We do have ones that are SD card reliant as well. But once you register to that Purple Air map, which is actually in the chat, it's live, and it's always going to be collecting information daily, so you don't have to manually go outside and constantly tweak it. Now in the case that, let's say that you have it, you know, on your, it's outside and maybe the wind may blow too hard, or sometimes even in the installation video, if it's too low to the ground, sometimes bugs, you know, they can fly and get inside the under part of the actual monitor. So in the case if that happens, that can knock the sensor down, but that can be a simple fix. And there's even in that instructional video, we have videos of how you clean out the air monitor. But it's actually pretty, it does the work for you. And at any point in time, if you wanted to get a download of, let's just say monthly data, then we can actually download it and share those reports with you to support you. If you were going to do, like, let's say a presentation, a local town hall or city council, we would definitely provide that technical support, but it's not something that you have to manually do every single day. It's just, it's automatic, uploaded.
Wow, that's really good. Other questions? Kay Loudermilk?
Yes. I am, whoops, I think I'm muted. Just
Nope.
I'm okay. What has been the impact of the environmental little monitors? What I would like to know is that once you did this and presented the information to someone, did they change things, and could you see the change on the monitors themselves?
Yes. So I'm hearing two questions. So one, the first question is, when we collect this data, have we been able to see changes at the local level? So yes, we have. I mentioned regards more so in the Charlotte-Mecklenburg area. And the reason why we have the most mobility there, not only, of course, we was founded in Charlotte and more than half of our team is in Charlotte. I mentioned that only 3 counties, there's 100 counties in North Carolina, and only 3 counties of those 100 actually have a county level air quality division. Mecklenburg is one of those counties. So fortunately, we've actually formed a great relationship with the Mecklenburg County Air Quality Division. We've done a number of programs and tabling together. But by us actually deploying hyperlocal air quality sensors, because their sensors, it's state sensors. And when we say hyperlocal, a lot of time the state sensors, if you even check your phone, oftentimes it can be your weather app. But the weather app, or even if you get on the EPA's website, if you're concerned about what the air quality is in your local area, you go to airnow.gov. All of those monitors are going to just show you, it's federal monitors and state monitors, but it's not going to show you necessarily, depending on where those monitors are, it could be 25 miles away from you. A state or federal monitor could be 25 miles away. So even though you can look on your phone, if it's saying that the air quality is good, but you're 25 miles away, that's inaccurate. So that's why we use things like Purple Air monitors, because it's going to give you the most hyper local information as much as possible. So when I mentioned the air keepers in the historic West End, it was multiple air keepers, and we've since deployed, I believe, 15 air monitors in the historic West End. They were actually able to put together a report that they shared with their county commission. So again, this is Mecklenburg. And from that presentation, they were able to actually get a federal air monitor from the EPA installed in the neighborhood. So that was very successful. And we would love for that to be replicated in all North Carolina communities, but it's much more difficult because, again, outside of Forsyth, Mecklenburg, and Buncombe County, we have to, when it comes to individuals advocating for whether it's a better permit, more equitable permitting process, it goes through DEQ, or Department of Environmental Quality. So when that happens, is we still continue to advocate, but it's just harder to advance changes at the state level because, of course, the state, that's the General Assembly. Whereas local actions, if you have a county, whether it's Mecklenburg County, that where there is more collaboration between county agencies. I mentioned that we have a good relationship with the Mecklenburg Air Quality Division. We have a good relationship with the Mecklenburg County Health Department. These are county level agencies. We work in partnership with each other, and in some counties, unfortunately, it's not as collaborative, but again, we said collaboration is key. We have to be able to work across the aisle. It doesn't matter if a person is in a rural setting, an urban setting, partisanships, air quality, it's a human issue. It doesn't matter, you know, what you look like, it's that we all need clean air. So we actually did receive a funding from the EPA to do air monitoring, hyperlocal air monitoring in Sampson County. Sampson County, of course, is a rural community here in North Carolina. And that grant, we won't begin that until maybe sometime this summer, if not fall, but that's a 3-year grant. And really that's going to be a potential model for if we're able to, of course, collect hyperlocal air quality over the next 3 years in Sampson County and work with community-based organizations out of Sampson. In addition to, we have support from RTI International that is using more advanced air sensors in addition to the purple air. We may be able to, and the exposures we're interested in, Sampson County is around CAFOs, concentrated animal feeding operations or livestock operations, as well as the landfill in Sampson County. Sampson County has the largest landfill in the state. A lot of the trash that and waste actually ends up in Sampson County. So there's a lot of emissions, including methane releases happening in Sampson County, hydrogen sulfide, VOCs, and vinyl chloride. I think a lot of people became familiar with vinyl chloride when the train actually got derailed in Ohio and there was releases of vinyl chloride. That is a hazardous air pollutant, or HAP, and that is a known carcinogen. So there is a lot of work that needs to be happening. So we need the support of individuals, but at the state level, what are some executive orders underneath the Cooper administration that is supporting the work that we do? I mentioned Executive Order 271, which is, it contributes to the Clean Transportation Plan. There is a lot of work at the state level at this time before the next transition. Cooper, we know he only has a remaining of just under 2 years in his administration. So whoever the next governor is, it's very, very important for individuals to know who their elected officials are at the state as well as at the local level. And all we can do is ask individuals, if you're aware of, do they support climate change efforts, or do they support, reducing greenhouse gas emissions? And if not, we want to provide that education and advocate for individuals to, constituents, hold your elected officials accountable as much as you can. But we have seen success, a lot of success in Mecklenburg, and we're hoping to go beyond Mecklenburg.
Thank you.
Welcome.
Other questions? Unmute yourself.
May I ask one?
Sure.
This has been such a wonderful presentation. Thank you so much. And I wanted to ask about, you were talking about policy at the state level, and you've also mentioned buses. And we know that our school buses are purchased through the state. Like we don't have autonomy locally to just choose that we want to buy electric buses. We have to go through the purchasing process through the state. I was wondering if you knew anything about that. Like, do you think there's any movement at all at the state level to support school districts getting electric buses?
Yes, I believe, because I mentioned Executive Order 271, which is the electrification of medium heavy duty trucks. So that actually can include school buses. So that's Department of Transportation, but also Department of Commerce, Department of Health and Human Services. So there's multiple state agencies that are working together to reduce greenhouse gas emissions. And children, I think if there's one population group that most individuals, can get behind, is that we have to protect the health of our children. So school buses, of course, releasing diesel emissions and other, air pollutants, that has been a priority. So with the Inflation Reduction Act, as well as the bipartisan infrastructure law, there is money coming down to the state level. And so the Department of Transportation is working with, as I mentioned, mentioned DHHS, and there's so much bills and support. Actually, just in my email today, there's actually like an EPA grant funding opportunity focusing around the electrification of school buses. So now more than ever is, when I say we're at a very landmark time in our country, is beforehand, oftentimes the issue was there's no money. How can we advance changes and purchase electrical, school buses or electrify vehicles, etc. Now there's billions upon billions of dollars coming down. And this is where we're now asking for, more transparency of, well, how are these dollars being allocated? So whether it's the electrification of school buses to protect, children, we're keeping tabs on it. And then of course, if you're registered on our advocacy network, on our website, we never spam. You'll get weekly, if not monthly, notifications. And school buses, because that has always been a cornerstone within CleanAire Carolina or CleanAire NC, that is a priority. So we'll be keeping tabs on it. And I do know within Mecklenburg, it's an acronym, GRADES, which is, got to remember what the acronym stands for. Reducing agent diesel, grants to reduce agent diesel, I guess it's emissions. I'm not quite sure. I'm butchering the acronym, but they're actually in the process. It's an incentive for companies, if they do want to retire their diesel emission vehicles, there's actually grant opportunity for them to do so, to transition to cleaner sources of transportation. So that hopefully, we're actually able to see that. But school buses and electrification, that is a priority, and that's coming down from the federal level as well.
Dick, did you have a question? You're muted. Okay, anybody else have a question? Just be sure you unmute yourselves.
I'm unmuted now, I think. Am I not?
Okay, yeah, I can hear you now.
Yeah, just a couple of comments, and I want to first echo what Margaret said about Kirsten's presentation. And certainly it was well done, and I'm an organization that has been off my radar, and I'm going to try and do a little more research. And I know Margaret posted some links during the presentation I want to try and follow up and look at. But air quality is something that we only think about when we have a fire like Weaver fire in Winston-Salem last year, where we get an acute smell and whatever, you're concerned about it. But air quality is something that is an issue, always an issue that we need to work on trying to improve. And education, of course, is important, but it's, I sort of equate it to maybe like the tobacco industry, where for a long time we were in denial about the impact of tobacco on our health. And I think in some respects, the same thing exists to some extent with air quality. So I think the more education and the more we get out and talk about these things, the better. It's a huge problem to solve. It's not, you got to just work on it a little bit at a time. So thanks, Kirsten, for a great presentation.
Well, thank you. And that's a perfect analogy in regards of the tobacco industry and just air quality in general. Because oftentimes, going back to the power of data, how do you make air pollution, which oftentimes it is invisible, and which is why we do deploy so many air monitors to communities, is because by the time that, whether you mention the Weaver fertilizer plant fire, or even if there's, a wildfire, by the time that we're actually able to see those emissions, the air quality, is of course significantly bad. But on daily days, especially for communities that live close to major highway systems, that's their daily experience. because there's all these heavy duty trucks, medium duty trucks coming through the neighborhood. And especially even if you live close to, a train or airport, for an example, those are their daily emissions, and it often may be invisible. But if we do have air sensors in those communities and, your radar is giving you a reading, of, air quality indexes in the yellow or orange or in the red, we're actually able to put a picture to what the air quality is, and of course individuals. So that's the quantitative data that policymakers need to see. Well, shows the evidence. And then of course the community members, they have their own, they're their own experts of their lived experiences. If they're a person who's living with asthma or COPD, and there's certain times of the year where, if they go outside, it's triggering an asthma attack, or they are experiencing symptoms, then, they live it, they know it. And for the longest number of times, we didn't have all the technology that we have now. So now we have to use these technology tools to give them to individuals who have been living these experiences for decades, for years. And now more than ever, they're actually able to provide that quantitative data piece that hopefully when we share it with policy decision makers, it can lead to policy changes that can protect the health of, again, all individuals, but again, beginning with communities most impacted.
All right, any more questions? We have a minute or so. Well, you mentioned many gases, polluting gases, Kirsten, and like methane, hydrogen sulfide, and so forth. Do these monitors measure all of these, or do they have to be programmed to do that? Or
so purple airs are particularly going to look at particulate matter 10, and when I say 10 and 2.5, that's just the sizes of the actual pollutant, and oftentimes they're invisible. So purple air is not going to look at something like hydrogen sulfide. Now they do have newer purple airs. It's the purple air flex, which actually is able to collect data around VOCs, or volatile organic compounds, which is a precursor to ozone pollution. But we are looking at to expand in our inventory to other monitors. The reason why we initially began with purple air, not only are they low cost, but they're easy to set up. But that Sampson County grant that I've referenced, we're actually partnered with RTI International. And RTI International, which of course they're a national or international nonprofit, but they do have more advanced sensors. So that's where collaboration comes in, where we're just a small but mighty group of 10 individuals. We do have to partner with organizations that have not only larger capacity, but more resources to assist us. So those sensors that RTI International will be deploying, along with what we'll be deploying, purple airs and flexes in Sampson County, they will actually be able to look at hydrogen sulfide and VOCs and methane.
I know some people blame asthma on like pollen and that sort of thing. And while that may be true, I mean, isn't it more exacerbated even by polluted air?
Yeah, so May is actually, it's Asthma Awareness Month. 2 days ago, May 2nd, Tuesday, it's always the first Tuesday in May, is World Asthma Day. So that it's a perfect way to segue, because I didn't go too much in the health bits, but I'm a person, I was diagnosed with asthma as a baby. So I live it. And our allergy seasons are definitely getting longer, because that's when the health impacts associated with climate change is that as the weather gets warmer, we have longer allergy seasons. And even for individuals who don't typically have allergy triggers, like the body constantly changes. But I know for this year, like beginning really in February, I started, whether it was the pollen, my eyes, and sneezing and, congestion. I like to be outdoors, but especially as we move into the summer months, and again, it's staying warmer much longer. That means that there's going to be more prevalence of those triggers. So whether it's pollen, ragweed, it does actually can exacerbate asthma attacks and asthmatic episodes. And allergic asthma is the most common form of asthma. You have exercise-induced asthma, but allergic asthma, that's what majority individuals typically have. And it is triggered by environmental pollutants or triggers, even within your indoor space. I didn't speak about indoor air quality because we've historically been in the outdoor, ambient outdoor space, but indoor air pollution is a thing, because going back to, if you do live in a community where there's poor air quality, and we're about to be in the summer months. If you don't have proper ventilation systems, what are you going to do? You're going to open up your window or open up your door. And if those air quality outside is bad, then that means that those outdoor air pollutants can get inside of your home and you're just trying to cool down. So yeah, there's a number of things, but we do work with, again, healthcare professionals to educate people where ways they can protect themselves. And in regards, I mentioned EPA, because we do get support. We work obviously with partners at the EPA. They do have, if you go to their website, actually instructions how to create a clean air room. So if you are an individual who lives with an underlying health condition, or you have a family member or loved one who has an underlying health condition, on poor air quality days, what are ways that you can make sure that your home is set up so you can hopefully create a clean air space or a clean air room, so you're able to reduce those possible triggers.
Great. Wow. I have learned so much, and you have given us such valuable information, Kirsten. Thank you so much. I just learned a lot tonight. And everybody, don't forget, and please share with other people that this session has been recorded on the League YouTube site. So I know I'm going to be looking at it again because I couldn't absorb all this. There was so much good information. So I'm going to be looking at it again. Is there any last question from anybody?
I have a question. I have my hand up.
I'm sorry, I couldn't see you. Okay.
I have a question about the monitors. Are those connected to the Wi-Fi of your home?
Mm-hmm. Yes, they do.
If you don't have Wi-Fi, you can't use the monitors.
If you don't have Wi-Fi, there are monitors that are SD card.
Okay.
So you can use that. It's not as mobile per se, but that is an issue that we're actually trying to navigate around. But SD sensors do not need Wi-Fi access. Okay. But it does require more kind of hands-on, because of course, if it's SD sensor, you may have to change out. Most of the county, Sampson County, for an example, that's a rural community. So broadband barriers do exist. And that's why we're working with organizations like RTI International to make sure that we have air monitors that are not just solely reliant upon Wi-Fi or broadband access.
Okay, well, thank you.
You're welcome.
Thank you for the presentation. It was really interesting.
Yes, thank you very much. Beautiful presentation.
Well, thank you all for providing me the opportunity to present to you guys. And again, share it with your friends, your network. We'll more than likely, we'll definitely, Carol, share it through our communications channel. So if you're not already signed up to our advocacy network, then you'll probably get an email from us saying, hey, check out this presentation. But yeah, there's a lot of things that are happening at the state level. So the work it's a marathon. It's not a sprint. There's a lot of work. So we definitely need groups like the Environmental Roundtable to support us. So thank you all. And hopefully you guys will hear communications from us, and, we can be a resource to you. Even if you're interested in hosting an air monitor, we're here for you guys.
Okay, thank you so much. And we'll look forward to even learning even more and connecting everything you said with whatever else we can learn about it. So you have really stimulated us to research and know more and do more. So thank you, Kirsten, very much.
You're welcome.
All right. Thank you.